Welcome. Thanks for joining us, and I'm sure you'll be happy you did. We have a wonderful guest with us today, Dr. Liselotte Schuster, and I'm very happy to introduce you to her. Welcome. Thank you for coming.
Thanks for having me, Oscar.
And thanks for your time. Tell us about yourself and anything else you'd like to tell us.
Well, my name is Liselotte Schuster, and people for short call me Lilo. I'm a chiropractic physician since 1989. And do you want to find out why I became a chiropractor?
Is it a secret?
It's not a secret.
Okay.
So as a little girl, I always knew I wanted to become a doctor. And my first exposure to chiropractic was my father literally crawling on the floor because he couldn't stand. He was in so much pain. So he would go to his chiropractor and come home. He'd be totally normal. So then when I was about 12 years old, I couldn't lean on the table with my elbow straight. It was painful. So my father, instead of taking me to the medical doctor, he ended up taking me to his chiropractor. The chiropractor felt my neck, gave me a chiropractic adjustment, and instantly I could lean on my arm. So that started to get me interested in something different than a traditional medical doctor. And then when I was getting my bachelor's in biology at Temple University, I took a class that was a holistic health class, and it was taught by a chiropractor. And it just felt so exciting to me because he talked about the body and how it heals itself, and you want to reduce any kind of interference so it can really do what it's meant to do. It's always adapting to different stressors, and you can use the chiropractic, combine that with nutrition, with exercise, with acupuncture, with a lot of other modalities that are about helping to support the body instead of suppress it or put a Band-Aid over it. So that really excited me, and that's how I got into becoming a chiropractic physician.
What kind of training do you have?
So the training was, for me, 4 years of undergraduate, getting my bachelor's in biology, and then the 4 years of chiropractic college.
You have 4 years.
Yes, it was 8 years total.
What about a medical doctor?
So,
how long does a medical doctor?
So this is the same type of training. Medical school, they also have to have their 4 years, so it's 8 years training as well to get their basics.
Same thing.
And so we're taking the same kind of classes. You have your anatomy, your physiology, your biochemistry, psychiatry, a little bit of pharmacology, diagnosis, tons of the same classes. The difference is that they are using how can we use medicine and surgery to work with the body. Chiropractic is how can we do the chiropractic adjustment, how can we learn about nutrition to help the body heal itself. So it's a very different philosophy, but a lot of the same training goes involved.
But you actually go learning, the training is the same amount of time as
it's the same amount of training, and as a matter of fact, when I was in chiropractic college, I went to the one that's in Lombard, which is here in Illinois, and I remember there were quite a few medical students that would come to our library to study, and they were very shocked and surprised at what kind of classes we were taking, the books that we had in our library. So it was like a pleasant surprise for them to see what our training was. So it was nice to see that.
So there must be quite a few people who have never gone to a chiropractor.
Yeah, I would say only about 10% of the population go to chiropractors.
Tell them why they should come to you.
So I can definitely tell you the benefits of what chiropractic is. So let me first start out with what people love to hear are professionals, athletes who go to chiropractors. And athletes, they want to be on the top of their game. So a lot of athletes will get chiropractic care. A lot of the NFL, I don't know if you realize this, but the NFL has chiropractors now in almost every single one of their, what are they called? Football, not a game, but the team.
The medical team.
A lot of tennis players get adjusted, basketball players get adjusted, weightlifters. A lot of them have to say that they will run faster, that they will recuperate much faster, that they're able to play longer.
So I can run faster if I come to you?
Well, then let's take that into the normal population. The normal population of adults and children, suppose they're athletes, if they start to get adjusted on a more regular basis, they're going to perform much better. They're going to not be injured as often. That's what the top athletes find. They're going to recuperate much faster. Now let's look at another thing about going to chiropractor is you improve your quality of life. Now how does that happen? If I have people that are coming to me, they have headaches all the time. If they have back pain, if they're not happy with how they feel, they're not engaging in their work as efficiently as they could. They're not engaging with their family as efficiently as they can, with hobbies that they have. So their quality of life improves dramatically when they start to get chiropractic adjustments for different kinds of pain and other kind of symptoms in their body. So it's, for me, it feels really exciting when someone will say to me, Dr. Schuster, I thought I was crazy, you know, other people weren't able to help me, you're able to help me. How wonderful that her quality of life is so much better because she feels so much better. So,
well, frankly, I'm a patient of yours.
Oh, yes.
And I have you here because you've done such a good job on me.
Thank you very much.
I can walk now.
You can walk. You're healed. But, and then I, you know, have some other things, the benefits you're asking me about. A lot of people, when I tell them I'm my chiropractor, they go like, oh, you know, pain in my back, pain in my neck, and they pretty much limit to us to only seeing adults. But what people don't realize is that the benefit also of a chiropractor is seeing children. And I see children, I see babies, and
what's the benefit of
the benefit is, you know, there actually was a study that showed 200 children that were getting frequently adjusted with a chiropractor
how old
versus
how old?
Toddlers to teenagers.
Really?
And then 200 kids that were not getting adjusted. Those that were getting adjusted had less sinus issues, less asthma, less allergies. So that's huge. How is that a benefit for the parents? They're not having to schlep their kids to the doctors all the time, and the kids can then engage in school. They don't have to take off from school as much. They feel better. It's a higher quality of life.
Would you say that chiropractors are more respected now than they were 10 years ago?
Absolutely. Chiropractic started in 1895. It was completely new. And throughout the years, we've had our struggles with trying to become more and more accepted. And definitely over the last 20, 30 years, it's become much more accepted. People know who we are, but it's still only about 10% of the population that are working with chiropractors.
I was going to say, where do you get your recommendations from?
How do people come in to see me?
Right.
I am strictly a referral practice where it's patients of mine who refer other patients to come in to see me. And so that's how it is for me.
I mean, do they come if they go to a doctor and then not getting better, or?
That's a lot of times what happens is that people have gone the main traditional route. You know, just thinking of a woman who's been having headaches for 30 years, migraine, been taking the medication, going to the doctors. They help, but she doesn't want to be on it for the rest of her life, so she's looking at something completely different. So I've had a lot of people like that where they've gone the traditional route. They're happy with it, but maybe it's not really doing everything that they want. So they want to look, is there another answer? Or parents where the kids will go to the doctor, they're constantly getting sinus infections or ear infections. They don't want to continue taking them on antibiotics. And so I'll start to work with them, and then they won't get the amount of ear infections or sinus infections. I'm sure that there's some that you count more than others. Absolutely. That's in any profession. You're going to have, absolutely, in any profession you have your wonderful success stories, and you have the stories where maybe you didn't help them the way that you wanted to. But that's in all professions. It's the people's fault, not yours. It's the people's fault. There are so many reasons why a person will heal or won't heal, and
really?
So absolutely.
Tell us a couple.
Well, you have to look. You have to be really thorough, and sometimes if a person doesn't get the results with the way they want in that first or second time, maybe you haven't found out, hey, you're constantly eating dairy all the time. And the more that you continue to eat dairy, that's going to prevent you from not having sinus issues. You know, maybe you are, I've had people who've come to me and they said, you know, I was doing a certain type of workout, and once I stopped doing that particular workout, I feel so much better. So you never know. That's why I'm always trying to talk to patients, figure out each time they come in, what are they doing with their lifestyle, because maybe there's that one little thing that they forgot to tell me on that first visit that's like, oh, this is also contributing to why you're feeling the way you are. Food, absolutely.
What's bad?
What's bad? You know what? That is very individual. One person can eat a vegetable and be okay with it, and another person can eat something and they can immediately have a sensitivity or a reaction.
How do we know?
How do you know? Okay. So if you have chronic problems that are just not going away, one thing that you can look at is identifying if you have food sensitivities. And there's a couple different ways you could do that. One is you can pretty much write down what foods do you eat. And you know what? Most of us, when we go to the grocery store, we eat the same foods all the time. We pretty much eat the same thing for breakfast, lunch, dinner, maybe a little bit of a variety. So if you start to eliminate all those foods, and then you start to add different foods, and if your symptoms start to feel better after about a week or so, chances are something that you're eating on a regular basis is creating some of your symptoms.
What are some of the foods that are really bad?
I shouldn't say bad, it can be more common.
Right.
Commonly, people will have reactions to gluten, wheat products, a lot of the grains that are out there, dairy products. A lot of people are having some of the artificial sweeteners, and you'd be surprised sometimes how sometimes artificial sweeteners can also create problems with the nerves as well. So I'm just thinking quickly, those are some of the common things that I talk to people about.
Part of your job is to find out what people eat.
Yeah, I will talk to them. There's a nutrition counselor that I work with who's in the office. We've been together since 1989, so the two of us absolutely can talk to people and work with if there's food reactions.
So would they go to her first and then you?
It's gone either way, but sometimes they'll see me, I'll work with them. If they need to go into a lot more detail, then they'll go and they'll see the nutritionist. But it's a great combination, definitely.
So basically what you're doing to people is to helping them lead a normal life.
Mm-hmm.
Now, it doesn't work all the time, I'm sure.
No, nothing works all the time except for oxygen.
You work all the time.
I work all the time. No, I have, like I said, I love what I do. I feel very blessed with the kids. We didn't also talk about chiropractic for pregnant women. What are the benefits for that? So I love working with pregnant women. I find it such a blessing. And so they'll come to me. The benefits are, first of all, that if they're having back pain, if they're having nauseousness, I've been able to help them with that.
Do the doctors recommend you?
There are some medical doctors, there are some OB-GYNs, some midwives who definitely will refer the patients in. And one of the main reasons is if they have a breech baby. And a breech is where the baby is not head down, instead the baby is head up. So typically, if you have a breech baby, you then have to have a C-section, typically. So if you want to prevent having major abdominal surgery, I have helped women. There's a specific technique that chiropractors around the world do, the Webster in utero constraint technique, and there's other things that I do as well to get that pelvis into better alignment, reduce any malpositioning of the pelvis, and the baby in that uterus isn't twisted, and a lot of times it'll flip, and it'll flip back down into the head down position. So that is a huge benefit if a pregnant mom can avoid having major abdominal surgery. It is. They're cutting into your abdomen, into the uterus. That's huge surgery. So if you can avoid that, that's a huge benefit.
And you get referrals from the doctors?
Yeah, from the OB-GYNs, or sometimes there's midwives. There's some of my patients who work with practices that mostly have midwives. They will have a OB-GYN that they work with as well, but primarily the patient goes to the midwives for care.
How about infants?
Absolutely. I've worked with babies. One of the benefits, again, with the chiropractic working with children, with babies, is when that baby is born, you want that baby to be nursing. And you want it to nurse really well. The immune system, it's extremely important for the baby to get the breast milk. And sometimes there's a lot of difficulties with breastfeeding, and so the mom gives up. But what she doesn't realize is when that baby's being pulled out a lot of times, most women don't squat and let nature take its course, so that a lot of times the health practitioner is tractioning on that baby to pull him out. That's huge on the neck. That's a major injury, and that can prevent the baby from turning and sucking the way that it should on the breast. Just think of, I think of an adult. A lot of times they'll come to me, I can't look when I'm driving. That's the same type of thing you have to think of with a baby. If it's hard for them to turn their neck, they can't get that sucking mechanism. So it's been fantastic to be able to work on the baby. They start nursing. Mom's happy, baby's happy.
So babies are a part of your life.
Absolutely, babies are a part of my life.
Can I ask you to show us another baby?
Yes. I have a little baby here. It's not real. This is, she's a cutie. But I brought this because a lot of people, like I said, only 10% of the population goes to a chiropractor. They're like, well, what do you do? Does it hurt? No, it doesn't hurt. Is it safe? Absolutely, it's safe. there's two ways that it's safe. One is my malpractice insurance as a chiropractor is so low, so low. If we were not safe, it would be skyrocketed,
Right.
but it's not. It's really, really low.
In other words, you can't really hurt anybody.
No. So,
no matter what you do, it doesn't.
Well, you know what? You have to be, with every single person that you're working with, you always have to find out, is there something that you cannot do? And I'll give you an example. If a child has Down syndrome, their ligaments are much more lax, and you know that you don't work on that very first vertebra in a very quick and adjust manner. You have to be very gentle. So you have to constantly talk to your patients, find out who they are, where they are, with how aggressive or gentle that you can work on them.
So
here's the baby.
What would you do with babies?
So what I would do with the baby.
Why would people bring the babies to you?
Okay, so
That's the
again,
first question.
you could have a baby. I've had babies that have come to me because they're not nursing well. Or
I mean, do these people come to you, or are they sent to you by the doctor?
It's been both. It's been one, they have found, well, here's a couple different ways. One is I have some people that will know a lot of people now, they go online. And when they go online, they start researching. And they find out, oh, wow, I didn't realize chiropractic could help this. They'll see who's a chiropractor in their area. They'll call. That's one way. Another is if I'm working with a pregnant woman, and I say to her, when you have this baby, if your baby is colicky, if your baby doesn't nurse, you bring that baby in and let me work on it, because chances are there's something that's going on with the spine and the neck, someplace that there's a little kink there. We have to work on that, and that's going to help this baby. And so that's another way, is my educating the patient.
Show us what you do with the baby.
So what I would do is I can use my hands. A lot of times I'll use my hands. Down here would be what's called the tailbone. You want to feel for, is there any tightness in here? I'll move the legs around.
The kids don't lay there like that, do they?
Well, you know what? Sometimes I'll have the babies on my leg. I have a table in the office, and I put a blanket down there, and I'll lay them down. And some babies are very comfortable laying on their stomach. Some of them, there's a kink in their back. They're uncomfortable, so they're more comfortable on my legs. Others, I'll lay them on their back and work with their neck. So again, what I'm feeling for is I'm going up the spine, and I'm feeling for where is there tightness. Every single vertebra on top of one another should have good range of motion, and when it doesn't, I'm feeling like, oh, that's tight in there. That needs to be released. So I can be using my fingers gently. I also have instruments. These are wonderful. It's a spring-loaded. I don't know if you can hear that very gentle.
Yeah. It hurts me when I hear it.
It hurts you. It's very gentle, and I will go up the spine, and I'll use it on parts of the spine. You can go on the hip. You can use it on different parts of the body, so it's very gentle.
Well, babies cry when you do this.
Oh, actually, yes. Sometimes babies will cry, especially if I get into the neck. They don't always like it, or a certain part of their spine that's tight. Just like if I'm getting a massage, and if it's uncomfortable, I'll feel that. Well, the baby can't talk to me, hello, it's sore there. They'll express it by crying. Lucky me. So they might cry. But a lot of times after the adjustment, the babies will sleep really well. They'll just be a lot more calm. But sometimes during the adjustment, they will be a little bit more cranky, or it's uncomfortable, and they'll let me know by crying. So yeah, so this is what I would do, and then you can make this bigger, pretend it's an adult.
Baby
same
looks very
thing.
comfortable to me now.
Baby's very comfortable, yes. So,
you did a good job.
Thank you. So I use instruments in my office. I use my hands. I'm feeling for the joints.
Teenage kids, they come?
I love working with teens.
Yeah,
those are great too.
Tell us about that.
So yes, I've had teens throughout the years. This is a great stage, with the hormones that are coming out and they're growing. Toddlers to teens are growing, so they're playing a lot of activities, sports. The thing too with the teens is, they're doing the texting. These kids are their posture is just so poor because they're texting all the time. So I really enjoy working with the teens, and they'll come to me again. They're people too, so they could have headaches, they could have sciatic problems, they can be in car accidents, they could have digestive issues, they could have sinus issues. So there's a lot of different reasons that the teens will come into me as well.
So you have all ages coming through.
All ages, exactly. Just like my grandfather, he was a general practitioner, and I remember he sold his practice after 50 years, and he sold it to 7 chiropractors because he believed in chiropractic. But I find that chiropractic, we are like a family physician. So it's like general practice is what I'm doing. Everybody's got a spine, so I work on everybody's spine.
So what are some of the problems you run into in terms of what you do?
What are the problems?
Do you have problems that you, I mean, nothing is perfect.
Nothing is perfect. So like I said, there are some people where, I'm pretty honest with people. I tell them, people will ask me, well, how do I know if this is going to work? And I said, well, I can work with what I find on your spine or any joints that are tight. We can talk about diet, etc. So you give me a handful of visits and let's see if this is the right path for you. And there's plenty of people where, yes, they notice a change and they feel a lot better, they notice improvement. And then there's always those people that maybe after 1 or 2 visits, they're not sure if this is for them. Or I've worked on them. I've had some patients where I've worked on their neck for numbness in their fingers, and after a few visits, I'm like, you know what? There's something else that's going on here. You need to go to an orthopedist, and you need to see if there's a major disc here that might need to have surgery.
What does orthopedics do that you don't do?
Well, a lot of times they'll do surgery. I don't do surgery.
I mean, that's
They prescribe medication. I don't prescribe medication. I'm not licensed to do that. So they will prescribe physical therapy, they'll prescribe medication, they will do surgery. So that's the difference. So same thing with like a neurologist. They will do surgery, they will prescribe medication, they will prescribe physical therapy, and some are becoming a lot more open to chiropractors. What's been really exciting is, as a chiropractor, I have to get 50 credit hours every year to maintain my license. And over the last about 4 or 5 years, there's been a couple of orthopedic groups that have been lecturing to chiropractors because they're really seeing the benefit of what they are able to do, and they are limited to their drugs and their surgery. But if they want to help people, a lot of their patients are coming into them saying, hey, I go to a chiropractor. So they've become much more open to how they can create relationships with the chiropractors, find out what we do, and it's been I find it's been very open, and it's been a great experience for me.
Do you have any problems?
Do I have any problems? What do you mean?
With all the good things that you're doing, what would you like to see changed or improved or different? Or nothing?
I'm pretty happy. I mean, I guess it would just be more and more communication between what chiropractors do and the mainstream. It's still, even though it's more, I still do find that a lot of medical doctors, they're just still not quite sure what we do. There still is that stigma, not for all of them, but there still is that separateness or uncertainty. So that would be lovely if there would be even more
Now, you have the same medical training as an MD?
Yes, I do. Well, again, medical doctors and chiropractors, we learn a lot of the same type of things in
No, but I mean, when you go to medical school, it's the same amount of time.
It's the same type of training. However, what medical doctors will do is then afterwards they will, have like a surgical round or pediatric round or orthopedic round. And there's some of that in chiropractic as well. But yes, it's very similar.
So now when people come to you, are there expectations that you have to comply with from a medical doctor?
Is there expectations to comply with a medical doctor? Well, there is communication with medical doctors, absolutely. So if you're working with a medical doctor and if they have certain things that they are referring their patients to, sure, you want to have the best communication with them and work with the patient and have good communication with the medical doctor.
Well, we've learned a lot about you, and you've taught us a lot. Now let's go to the other strength.
The other strength,
singing.
Yes. Singing,
Tell us a little bit about your singing, and you're going to leave us with a song.
I will leave you with a song.
Well,
I'm going to put the baby down. So my father has a jazz band in South America, and so when I was growing up...
By the way, just to interrupt, the opening of our program here had your father's music on it.
That's the song is called the Court of King Oliver.
Which you gave us when you were here.
And I gave that CD to you, which had his band.
Yes.
And so that's, as a kid, I grew up with my father, with the jazz, with my mom, with the classical and the opera, so I was very much exposed to music. I love music, and then everything that's on the radio that's current throughout the years, I keep current as well. So I have a variety.
Any kind of music?
I like everything. I really do.
You're kind of made. You like everything. You love your work. Everything's great.
Hey, I try to be as happy as possible.
You come here and you make it great for us.
But as far as singing, you know, I would sing in high school. I sang in the high school plays, and then I have sang in a harmony band about 6 years ago or so. In a show that I did, my group came here and we sang harmony.
Yeah.
We went to the Old Town School of Folk Music, so that's how we found out about each other and met and created a band.
Do you do much now?
And then with my father, over the last 10 years, I would go down to South America, and he has his jazz band, and I would sing with his band. And right now, that's been kind of put on the back burner. I actually started my own TV show in Evanston because of being on your show 6 years ago. So I've been busy doing that.
I feel good now.
Thank you. So, yes, so I've sang jazz, I've sang harmony, I've actually wrote my own songs as well about babies and infant massage. I used to be an infant massage instructor.
Would you like to give us a sample of a little
song?
Sure.
So I thought it would be apropos to sing a song. This is the first song that my father ever...
Just interrupt you for a minute.
Okay.
This would be a song that leaves our program.
Okay.
Believe it or not, we've had a...
You're done?
Done. So you're going to leave us with your song.
Okay. All right. So this is for my father. This was the first song that he ever heard on the record player back in like 1939, 1940. So it's called Goody Goody. So you met someone who put you back on your heels. Goody goody. You met someone and now you know how it feels. Goody goody. You gave her your heart too, just as I gave mine to you. And she broke it in little pieces. Now how do you do? You lie awake just singing the blues all night. Goody goody. And you think the love's a barrel of dynamite. Hooray and hallelujah, you had it coming to ya. A goody goody for her, goody goody for you. And I hope you're satisfied, you rascal, you, oh yes. I hope you're satisfied, you rascal, you rascal, you.